Breast cancer. In 2022 alone, 2.3 million women were diagnosed with breast cancer, making it one of the most common cancers in the world. While it mostly affects women, men aren't completely safe from it either. It happens when certain cells in the breast start growing uncontrollably, forming a lump or mass. Sometimes these lumps are harmless, but other times they can be life-threatening, spreading to other parts of the body if not caught in time. And you know what makes it even more complicated? There isn't just one type of breast cancer. The two most common ones are invasive ductal carcinoma, IDC, which starts in the milk ducts, and invasive lobular carcinoma, ILC, which begins in the milk-producing lobules. Scientists still don't have all the answers on why it happens, but factors like genetics, hormones, and age seem to play a role. And here's where it gets tricky. Not everyone notices symptoms right away. Some might feel a lump, while others might see changes in breast shape, skin dimpling, or unusual nipple discharge. But for some, there are no warning signs at all. That's why doctors emphasize self-exams and mammograms, because catching it early can make all the difference. Treatment options have advanced significantly over the years. Surgery, chemotherapy, radiation, and hormone therapy all help in different ways, depending on the stage of cancer. Colorectal cancer. According to the World Cancer Research Fund, colorectal cancer accounted for 1,926,425 new cases in 2022, making it one of the most common and deadliest cancers. This cancer affects the colon or rectum, which are both parts of the digestive system. It starts when abnormal cells in the lining of the colon or rectum begin to grow uncontrollably, forming polyps. At first, these polyps are harmless, but over time, some can turn cancerous and spread. And you know what makes it even more concerning? It often develops silently. In the early stages, there might be no symptoms at all. But as it progresses, people may start noticing things like changes in bowel habits, blood in the stool, unexplained weight loss, or constant fatigue. Because these symptoms can be mistaken for other digestive issues, many people don't realize something is wrong until the cancer has already advanced. That's why screening is so important. A colonoscopy can detect and remove polyps before they turn into cancer, making it one of the most effective ways to prevent the disease. Doctors usually recommend regular screenings starting at age 45, or even earlier for those with a family history of the disease. When caught early, colorectal cancer is highly treatable. Surgery, chemotherapy, and radiation therapy are common treatments, and survival rates are much higher in cases detected in the early stages. Kidney cancer. Your kidneys work 24/7, filtering blood, balancing fluids, and keeping your body running smoothly. But sometimes, abnormal cells start growing uncontrollably inside them, leading to kidney cancer. The most common type is renal cell carcinoma, RCC, which develops in the small tubes inside the kidney. It can grow silently for a long time before showing any signs. Unlike some cancers that make their presence known early, kidney cancer can go unnoticed for years. When symptoms do appear, they can be subtle at first: blood in the urine, persistent lower back pain, or a lump near the kidney area. In more advanced cases, weight loss, fatigue, and high blood pressure can also be warning signs. Because these symptoms often overlap with other conditions, many people don't realize something is wrong until the disease has progressed. So, what increases the risk? Smoking, obesity, high blood pressure, and genetics all play a role. The best chance at beating kidney cancer is early detection. When caught in its early stages, it can often be treated with surgery to remove the tumor or, in some cases, the entire kidney. Unlike other cancers, chemotherapy isn't very effective for kidney cancer, so doctors rely on targeted therapies and immunotherapy to stop it from spreading. Bladder cancer. Bladder cancer starts when certain cells in the bladder lining begin to grow uncontrollably. The most common type, urothelial carcinoma, affects the cells responsible for expanding and contracting as the bladder fills and empties. In its early stages, it stays in the bladder lining, but if left untreated, it can spread to deeper layers and even other organs. And do you know what the most common early sign is? Blood in the urine. Sometimes it's clearly visible, pink, red, or brownish, but other times it can only be detected with a urine test. Other symptoms include frequent urination, pain while peeing, or feeling the urge to go even when the bladder is empty. The problem is that these signs can easily be mistaken for a urinary tract infection, leading many to ignore them. So, what are the risk factors? Smoking is the biggest culprit. Harmful chemicals from cigarettes end up in the bladder, irritating and damaging its lining over time. Long-term exposure to industrial chemicals, radiation, and chronic bladder infections can also raise the chances of developing it. Early tumors can be removed with a TURBT procedure, and some cases need BCG therapy, an immunotherapy that activates the immune system to attack cancer cells. More advanced cases may require chemotherapy, radiation, or even bladder removal. Lung cancer. Lung cancer is the second most common cancer in the United States, with an estimated 226,650 new cases expected in 2025. Lung cancer happens when cells in the lungs start growing uncontrollably, forming tumors that interfere with breathing. It's one of the deadliest cancers because it often goes unnoticed until it has already spread. There are two main types: non-small cell lung cancer, NSCLC, which makes up about 85% of cases, and small cell lung cancer, SCLC, which is more aggressive and spreads faster. And here's where it gets dangerous. Early symptoms are easy to miss. A persistent cough, shortness of breath, chest pain, and unexplained weight loss are some of the warning signs. But many people mistake them for something minor, like a cold or allergies. By the time symptoms become severe, the cancer has often advanced to later stages, making treatment more difficult. And the biggest risk factor? Smoking. It's responsible for the vast majority of lung cancer cases, with harmful chemicals and tobacco damaging lung cells over time. However, non-smokers aren't completely safe either. Exposure to secondhand smoke, air pollution, radon gas, and industrial chemicals can also increase the risk. Early-stage cases may be treated with surgery, while advanced cases often require chemotherapy, radiation, targeted therapy, or immunotherapy. Pancreatic cancer. Pancreatic cancer is one of the most difficult cancers to detect early, and that makes it one of the deadliest. It starts in the pancreas, an organ that helps with digestion and blood sugar control. The problem is that symptoms don't usually show up in the beginning, and by the time they do, the cancer has often spread to other parts of the body. So what are the signs? Unexplained weight loss, jaundice, yellowing of the skin and eyes, stomach or back pain, and digestive problems are some of the most common. Some people also notice their skin becoming itchy, or their urine turning darker. However, because these symptoms can be linked to many other conditions, pancreatic cancer is often overlooked until it's in an advanced stage. Doctors don't know exactly why some people get pancreatic cancer, but smoking, obesity, diabetes, chronic pancreatitis, and family history all seem to increase the risk. Unlike some other cancers, there isn't a routine screening test to catch it early, which makes prevention and awareness even more important. When it comes to treatment, surgery is an option, but only for cases that are caught in the early stages. More often, patients need chemotherapy, radiation, or targeted therapy to slow the cancer's spread. Prostate cancer. Prostate cancer is one of the most common cancers in men, especially those over 50. According to the American Cancer Society, an estimated 1.5 million men are diagnosed with prostate cancer each year. Prostate cancer starts in the prostate gland, which sits just below the bladder, and helps produce semen. In many cases, it grows so slowly that a person can live with it for years without any issues. But not all cases are the same. Some grow aggressively and spread, making early detection critical. One of the biggest challenges with prostate cancer is that it often doesn't cause symptoms in the early stages. When signs do appear, they can include frequent urination, especially at night, difficulty starting or stopping urination, weak urine flow, or blood in the urine or semen. Some men also experience pain in the lower back or pelvis, but by the time symptoms become noticeable, the cancer may already be advanced. Scientists aren't entirely sure what causes prostate cancer, but age, genetics, and diet seem to play a role. It's more common in men with a family history of the disease, and African American men are at higher risk for reasons still being studied. The good news is that screening tests like PSA, prostate-specific antigen, and digital rectal exams can detect it early when treatment is most effective. Treatment depends on how aggressive the cancer is. Some slow-growing cases don't need immediate treatment and are simply monitored over time. But for more advanced cases, options include surgery, radiation, hormone therapy, and chemotherapy. Skin cancer. Skin cancer is the most common type of cancer, and the sun is one of its biggest triggers. It develops when skin cells grow uncontrollably, usually due to excessive exposure to ultraviolet, UV radiation from the sun, or tanning beds. While some types are less aggressive, others can spread quickly if not treated in time. There are three main types: basal cell carcinoma, BCC, squamous cell carcinoma, SCC, and melanoma. BCC is the most common and tends to grow slowly, appearing as a pearly bump or a sore that won't heal. SCC often looks like a rough, scaly patch or an open wound. Melanoma, the most dangerous type, can start as an unusual mole that changes in size, shape, or color. Unlike BCC and SCC, melanoma can spread to other parts of the body if not caught early. Protecting your skin is the best way to prevent skin cancer. Wearing sunscreen, avoiding excessive sun exposure, and skipping tanning beds can reduce the risk significantly. But even with precautions, regular skin checks are important, especially if you notice a new or changing mole. The ABCDE rule, asymmetry, border, color, diameter, and evolution, helps in identifying suspicious spots that might need medical attention. Surgery is the most common treatment option, especially for BCC and SCC, which can often be removed completely. Melanoma may require additional treatments like immunotherapy, radiation, or targeted drugs if it has spread. Uterine cancer. Uterine cancer is the most common type of cancer affecting the female reproductive system. It starts in the lining of the uterus, endometrium, and is often referred to as endometrial cancer. While it can sometimes be slow-growing and easier to treat, in other cases, it spreads quickly, making early detection crucial. One of the biggest warning signs is unusual vaginal bleeding. Women who have gone through menopause should never ignore spotting or bleeding, as it could be a red flag. For younger women, very heavy or irregular periods can sometimes indicate a problem. Other symptoms include pelvic pain, pain during intercourse, and an abnormal vaginal discharge. These signs don't always mean cancer, but they should never be ignored. Doctors don't always know why some women develop uterine cancer, but obesity, high estrogen levels, and family history seem to increase the risk. Conditions like polycystic ovary syndrome, PCOS, and diabetes may also contribute. Since this cancer is strongly linked to hormonal imbalances, women who take estrogen therapy without progesterone or have never been pregnant might face a higher risk. If detected early, uterine cancer is highly treatable. Surgery to remove the uterus, hysterectomy, is the most common approach, often curing the cancer completely if it hasn't spread. In more advanced cases, doctors may use radiation, chemotherapy, or hormone therapy to slow its progression. Liver cancer. Liver cancer is one of the most serious types of cancer, but it doesn't always get the attention it deserves. Each year, more than 800,000 people worldwide are diagnosed with this disease. The liver is a vital organ. It filters toxins, helps digest food, and keeps your body running smoothly. When cancer develops here, it can be hard to treat, especially if it's not caught early. There are two main types. Primary liver cancer starts in the liver itself, usually as hepatocellular carcinoma, HCC. Then there's secondary liver cancer, which means the cancer starts somewhere else, like the colon or lungs, and later spreads to the liver. No matter where it starts, liver cancer can be aggressive, which is why early detection is so important. And here's the problem. Liver cancer rarely shows symptoms in the early stages. By the time people start feeling sick, the disease is often already advanced. Some of the first signs to watch for include unexplained weight loss, nausea, loss of appetite, stomach swelling, and yellowing of the skin, jaundice. Many people also feel tired all the time but don't think much of it. So what causes it? Chronic liver damage is the biggest risk factor. Long-term infections like hepatitis B or C, heavy alcohol use, obesity, and fatty liver disease can all lead to cirrhosis, which increases the chances of cancer. Since the liver can regenerate, it tries to heal itself, but repeated damage over time can lead to cancerous growth. Treatment depends on how early the cancer is found. Surgery or a liver transplant might be an option if the tumor is small. But in later stages, doctors often use targeted therapy, immunotherapy, or chemotherapy to slow the disease down. Thank you for watching. If you enjoyed the video, please consider subscribing and liking the video. It helps us out a lot.